If your body has been giving you small warnings lately, please do not brush them aside. A lot of people over 60 tell themselves, "I'm just getting older," and they keep pushing through. But sometimes what feels small is not small at all. Sometimes your body is not being dramatic. It is being honest. It is asking for rest, for attention, for a slower pace before a bigger problem shows up. And one of the signs we'll talk about today is so easy to miss that many people do not take it seriously until it leads to a fall, a frightening night, or a rushed call for help. I want you to stay with me, because this is not about fear. It is about noticing what many people miss. The body often whispers before it shouts. It gives clues in your energy, your balance, your sleep, your breathing, your thinking, and even in how your shoes fit at the end of the day. These changes can look harmless at first. But when they repeat, or slowly get worse, they may be your body telling you to slow down and pay attention now, while you still have more control. I'm Dr. Amelia Watson, and I want to talk with you the way I would talk with someone I care about deeply. Slowing down does not mean giving up. It does not mean becoming weak. It means protecting your strength. It means guarding your independence. It means being wise enough to notice changes early so you can stay safer, steadier, clearer, and more confident in daily life. And that is especially important after 60, because small signs can carry bigger meaning than they used to. Before we get into the first sign, let me say this. If you ever have chest pain, severe trouble breathing, fainting, sudden confusion, sudden weakness on one side, trouble speaking, or a severe new headache, that is not a wait and see moment. Please get emergency help right away. But for the quieter signs, the ones people live with for weeks or months, this conversation can help you know what to watch for and what to do next. And if you've ever caught yourself saying, "I thought it was nothing," then this video is for you. Let me know in the comments how old you are, or which of these signs you've noticed in yourself or someone you love. I read those comments carefully, and they help me create videos that truly meet you where you are. And if you find this helpful, subscribing is a simple way to stay connected to calm, clear health guidance made with older adults and caregivers in mind. The first sign your body may be telling you to slow down is tiredness that no longer makes sense. I'm not talking about feeling sleepy after a busy afternoon or after poor sleep once in a while. I mean a deeper kind of fatigue. The kind that hangs on. The kind that makes everyday tasks feel strangely heavy. You wake up tired. Making breakfast feels like work. Folding laundry feels bigger than it should. A short walk feels longer than it used to. And by the middle of the day, you already feel spent. Here's the part many people miss. Ongoing fatigue is not always about age. It can be related to poor sleep, stress, low activity, depression, dehydration, low iron, blood sugar changes, infections, medication side effects, or health problems involving the heart, kidneys, lungs, or thyroid. Sometimes it builds so slowly that you adjust to it without realizing how far your energy has fallen. You stop doing little things. You rest more. You cancel plans. You take longer to recover. And after a while, tired starts to feel normal, even when it should not. I once had a patient tell me, "I thought I was just slowing down." But what she was really feeling was a mix of poor sleep, mild dehydration, and a medication that was leaving her foggy during the day. Nothing dramatic. Nothing flashy. But together, those things were draining her life. And that is why this matters. Fatigue is easy to dismiss because it seems common. But common does not always mean harmless. So what should you do if this sounds like you? First, do not force yourself to power through day after day as if your body is being lazy. That usually backfires. Instead, get curious. Ask yourself when the tiredness started. Is it every day? Is it worse in the morning or later on? Did it begin after a new medicine, a stressful event, an illness, or a change in sleep? Are you eating enough? Drinking enough? Moving enough? If fatigue lasts for weeks, or it's getting worse, it is a smart idea to talk with your doctor and describe exactly what daily life feels like now compared with a few months ago. The second sign is dizziness, lightheadedness, or feeling unsteady when you stand up or walk. This one matters because it can seem mild right up until it causes a fall. Some people call it feeling floaty. Others say, I just need a second after I stand. Some feel the room spin. Some feel weak in the legs. Some simply stop trusting their own steps. And once that happens, confidence begins to shrink. You avoid stairs. You hold onto furniture. You walk slower. You go out less. Life becomes smaller. Dizziness can come from several places. It can happen when you are dehydrated. It can happen if your blood pressure drops when you stand up. It can happen with inner ear problems, infections, blood sugar shifts, certain heart rhythm problems, vision changes, or side effects from medication. Sometimes even medicines that are helpful can make you feel less steady, especially when you are taking several at once. This is why a new dizzy spell should never be treated like a personality trait. It is information. Let's make this simple. If you feel dizzy when you stand, pause. Sit back down if you need to. Stand more slowly next time. Hold onto something steady. Keep rooms well lit. Wear shoes that grip the floor instead of slick slippers or socks alone. And if you notice that dizziness started after a change in medication, do not stop the medicine on your own. Talk to your doctor or pharmacist. Ask whether the timing, dose, or combination could be part of the problem. That one question can be very important. Now this is important. If dizziness is sudden, severe, keeps happening, or comes with chest pain, fainting, weakness, slurred speech, shortness of breath, or a severe headache, do not wait. Get urgent medical help. A dizzy spell is not always just dizziness. Sometimes it is the body waving a much bigger flag. The third sign your body may be asking you to slow down is poor sleep that leaves you drained the next day. So many older adults tell me, I just don't sleep like I used to. And yes, sleep can change with age. But not every sleep problem should be accepted as normal. If you are lying awake for long stretches, waking up over and over, rising too early, or waking tired every morning, your body is not getting the reset it needs. And that can affect almost everything. Poor sleep does more than make you yawn. It can make memory feel weaker. It can make your mood shorter. It can make pain feel worse. It can raise the risk of falls because your balance, patience, and focus are not as strong when you are worn down. It can affect blood pressure, blood sugar, appetite, and even how well you cope with stress. In other words, sleep is not a luxury. It is repair time. The trouble is that people often chase sleep the wrong way. They nap too long during the day. They drink too much coffee late in the afternoon. They watch upsetting news right before bed. They stay in bed awake for hours. Or they take something to make themselves drowsy without first asking why sleep has become a problem. Sometimes the answer is pain. Sometimes it is stress. Sometimes it is sleep apnea, frequent urination, restless legs, grief, or medicine timing. That is why paying attention matters more than guessing. If your sleep has changed, try to notice patterns. Do you fall asleep easily but wake at 3 a.m.? Are you sleepy all day? Do you snore heavily? Do you wake with headaches? Do you feel more tired even after a full night in bed? Those details matter. And if sleep problems keep going, bring them up with a healthcare professional. Please do not be embarrassed to talk about sleep. It affects far more than people realize. The fourth sign is shortness of breath, swelling in the feet or ankles, or a sudden change in weight over a few days. This is one of the most overlooked signs, because it often sneaks in quietly. Maybe you notice the stairs feel harder. Maybe you need to stop and catch your breath during a short walk. Maybe your socks leave deeper marks than they used to. Maybe your rings feel tighter. Maybe you feel uncomfortable lying flat and need extra pillows at night. These are not details to ignore. There are many reasons this can happen. Fluid can build up. The heart may be under strain. The lungs may not be working as well as they should. Kidney problems can play a role. Circulation changes can show up in the legs first. And sometimes what looks like simple swelling is actually part of a bigger pattern that includes fatigue, coughing, poor sleep, or feeling weaker than usual. That is why I want you to notice the whole picture, not just one symptom at a time. A lot of people wait for pain before they take breathing changes seriously. But shortness of breath does not always arrive with pain. Sometimes it shows up as a quiet change in daily life. You stop carrying groceries in one trip. You avoid hills. You sit down more often. You say you are just out of shape, even though the change came on fairly recently. Here's the part many people miss. When the body starts limiting you without your permission, that is worth respecting. If you notice swelling, breathlessness, or fast weight gain, slow down and pay attention. Weigh yourself at the same time of day if your doctor has asked you to monitor changes. Notice whether swelling is new or worsening. Notice whether breathing is harder when you lie down or walk. And if you have chest pain, severe trouble breathing, blue lips, confusion, or you cannot catch your breath while resting, please get emergency care right away. The fifth sign is brain fog, unusual confusion, or memory changes that feel different from your usual self. Let me be clear. Everyone forgets things from time to time. Misplacing glasses once in a while is not the same as suddenly feeling mixed up. But if you are missing medicine doses, getting confused by simple steps, repeating yourself much more than usual, or feeling mentally cloudy in a way that is new for you, do not shrug it off too quickly. Thinking changes can come from more than one cause. Poor sleep can do it. Dehydration can do it. Infections can do it. Low oxygen, blood sugar swings, grief, stress, and medication side effects can all affect the brain. So can more serious problems, including stroke. That is why timing matters. If confusion comes on suddenly, especially with trouble speaking, one-sided weakness, a drooping face, sudden vision change, or loss of balance, call emergency services right away. Even if it goes away fast, it still needs urgent attention. Families often notice this sign before the person does. A daughter may say, "Mom just isn't herself today." A spouse may notice that the bills are piling up unopened. A caregiver may realize that a simple routine suddenly feels overwhelming to someone who usually manages it just fine. These changes matter. The goal is not to panic. The goal is to notice what is different and respond early. This is also a good place to talk about medication safety, because it is such a common hidden issue. Many older adults are taking several medicines, and some combinations can affect balance, alertness, sleep, appetite, blood pressure, or memory. That does not mean the medicines are bad. It means the full list needs to make sense together. If your body feels different, ask your doctor or pharmacist to review everything you take, including over-the-counter pills, sleep aids, vitamins, and supplements. And please never stop a prescription medication suddenly unless a qualified healthcare professional tells you to. The sixth sign is low appetite, dryness, dark urine, constipation, or that heavy dragged-out feeling that gets worse as the day goes on. In simple words, this may be your body saying, "I need more support. I may not be getting enough fluid or nourishment." Dehydration can sneak up on older adults because the sense of thirst may be weaker with age. Some people do not feel thirsty until they are already behind. Others avoid drinking because they do not want to use the bathroom as often. And slowly, without much warning, the body begins to struggle. Dehydration does not always look dramatic. Sometimes it looks like tiredness. Sometimes it looks like dizziness. Sometimes it looks like confusion, dry mouth, headache, or darker urine. Sometimes it shows up as constipation or poor focus. And if a person is taking water pills, has been sick, is spending time in hot weather, or simply is not eating and drinking enough, the risk can rise quickly. That is why this sign matters more than many people think. But there is something very important to say here. Not everyone should simply start drinking large amounts of water. If you have heart failure, kidney disease, liver problems, or you've been told to limit fluids, you need advice that fits your body. So think of hydration as something to review wisely, not something to guess at. Ask your doctor what amount is right for you. And if you are a caregiver, gently noticing what someone drinks in a day can tell you a lot. Now I want to share one practical insight that can make a big difference, and I saved it for this part, because it ties all 6 signs together. Start keeping a simple body signal notebook for 2 weeks. Just 2 weeks. Write down your energy in the morning, whether you felt dizzy when standing, how you slept, whether your ankles were swollen, how your breathing felt during normal activity, what your appetite was like, and whether your thinking felt clear or foggy. Also note any medication changes, missed doses, or stressful events. You do not need anything fancy. A cheap notebook works just fine. The reason this helps is simple. Memory is often not enough. When symptoms come and go, people forget details. But patterns tell the truth. You may realize your dizziness is worse on days when you drink very little. You may notice swelling gets worse after a poor night's sleep or salty meals. You may see that fatigue grew after a new prescription. Or you may discover that your bad days are no longer once in a while. They are becoming the norm. That is powerful information. When you bring that notebook to a doctor's visit, the conversation becomes clearer. Instead of saying, "I don't know, I just haven't felt right," you can say, "For the past 2 weeks I've been tired every morning, dizzy when standing, and short of breath walking to the kitchen. My ankles are more swollen by evening, and I started a new medication last month." That gives your healthcare team something real to work with. It can lead to better questions, better testing, and better decisions. There is another quiet sign I do not want to leave out, and that is when ordinary life starts feeling harder in ways you can't quite explain. Maybe you are not in pain. Maybe nothing dramatic is happening. But tasks you used to manage now feel like too much. You need more rest after bathing. You dread errands. You avoid social events because they take too much energy. You feel less steady in the shower. You stop cooking full meals because standing at the counter feels tiring. These changes count. Sometimes they are the earliest evidence that your body is under strain. Please do not wait until you are completely overwhelmed to ask for help. Independence is not about doing everything alone at any cost. True independence often comes from getting support early enough to prevent a crisis. That might mean reviewing your medicines. It might mean checking your sleep. It might mean talking about blood pressure, blood sugar, kidney function, circulation, or heart symptoms. It might mean adjusting your routine so your body is not pushed beyond what it can safely handle right now. And for caregivers watching this, I want to speak to you for a moment too. You are often the first to notice when something changes. You see the slower walk, the unopened water bottle, the extra naps, the growing confusion, the tighter shoes, the missed pills. Trust what you are seeing. You do not have to accuse or alarm someone. You can simply say, "I've noticed a few changes, and I care about you. Let's look into this before it gets bigger." Sometimes that gentle sentence opens the door. If you are the one noticing these signs in yourself, please be kind to yourself. Your body is not failing you by giving warnings. It is trying to protect you. It is asking you to listen sooner. There is strength in that. There is wisdom in slowing down long enough to ask, "What is this trying to tell me?" That question alone can change the direction of your health. Let me leave you with one simple next step. Today, choose one thing to notice more carefully for the next 7 days. Your energy, your sleep, your balance, your swelling, your breathing, your appetite, your thinking. Just one. Pay attention without fear. If something seems off, write it down and bring it to someone qualified who can help. Small action now can prevent much bigger trouble later. Your goal is not to become anxious about every ache and every tired day. Your goal is to become aware. Calmly aware. Because when you know your body well, you can notice when something changes. And when you notice changes early, you give yourself the best chance to stay steady, stay strong, and stay independent longer. If this helped you, tell me in the comments which sign stood out most to you, or which topic you want me to cover next. And if someone you love has been saying, "I'm fine," even though you can see they are slowing down in ways that worry you, please share this with them. Sometimes the most caring thing we can do is help someone hear the message their body has been trying to send. And remember, slowing down at the right time is not giving up on life. It is one of the smartest ways to protect it.